We're going to be talking about type 1 diabetes today. And Dr. Ayoade and we decided to talk about this topic because it's very pertinent. We do know a lot of adults get diabetes, but guess what? Children get diabetes too. And with adult diabetes, usually it's type 2 diabetes. There's type 1 and type 2. For children, we usually see type 1 diabetes. We're going to go ahead and discuss further. So Dr. Ayoade, please start it off.
So diabetes is actually like an endocrine problem, and that is there is not enough insulin in the body. So the pancreas, which is the organ that produces insulin, for whatever reason, is not just doing its job properly. So there is either very little or no insulin at all in type 1 diabetes. And it can be acquired in different ways. It can be genetic. Sometimes even after viral infections, there's some viruses that are quite troublesome and can trigger a problem in the pancreas and cause diabetes.
Now that's from antibody production, where the body attacks the pancreas.
Absolutely.
And there's not enough insulin. Yeah. So generally, diabetes, people know it as an endocrine problem because insulin is a hormone, and anything that has to do with hormones falls under endocrine in medicine. So when a child comes in with diabetes, type 1 diabetes is more common in pediatrics. We do see a lot of type 2 diabetes in obese children, but the commoner diabetes that we're talking about today is type 1 for children. Adults get the type 2, and that's usually from insulin resistance, where you have insulin, but there's so much sugar or there's a lot of calories on board that is not enough to help the patient to maintain a blood sugar. So insulin basically pushes blood glucose into the cells, and that's when the cells use energy for living. So if you have a deficiency of insulin, that means that you're not using the food that you're eating. So what are the common presentations that you've seen with children with diabetes?
Quite varied. Sometimes you just have a child that was quite playful and all of a sudden just gets quiet and stop being that active. Is a bit moody, is a bit clingy, just gets very quiet. Sometimes you just find out that the child is losing weight, almost as if the child is drying out. So this child is eating, but just keeps losing weight, and you're wondering what's going on with my baby. Another thing, one of the most common is frequent passing of urine. The child just starts passing lots of urine, also drinking more than usual. So it's always asking for something to drink. I want something to drink, water, whatever it is, something to drink.
And eating a lot.
And eating a lot.
Yeah.
So sometimes the increased passing of urine translates to bedwetting. This is a child that has never bedwetted, and all of a sudden, every night in the morning, there's urine all over the bed, and you're wondering, why is this child suddenly bedwetting? So that's another common symptom of diabetes.
Yeah, in medicine, we used to cram the three P's.
Okay.
Polyuria, meaning you're peeing too much. Polyphagia, you're eating too much.
Polydipsia.
And polydipsia, you're drinking. So too much urine, too much passing of urine, too much eating, too much drinking, but yet everything is coming out. And that's because the insulin isn't there to push all the sugar into the cells. So basically, those children are passing sugar in their urine.
Absolutely.
And I had a child who was 3 years old, and this mom comes in the US, and the mom says, "Doctor, I don't know what's going on with my child. My child won't move. He's just laying there very still and clingy, just like you said." And I was working in a private doctor's office at the time, and we didn't have all the tests to check for diabetes. So I'm like, "Mom, let's check his urine." We check his urine. He had 4+ glucose. Wow. And that child, we had to send him straight to the hospital. We had to do all the tests and everything and put him on insulin and basically got the diabetic educators and all the good stuff. But anyway, if you are not sure, and if a child comes in with these symptoms, have diabetes at the back of your mind as physicians. But if you're a parent,
a lot of parents don't believe that children can get diabetes.
Exactly.
A lot of parents do. And usually you can see diabetes from age 3.
Yes.
As early as age 3.
Yeah, exactly. Even earlier. So generally, we're going to talk about diabetes in 2 phases, just because there's a bit more on the management, diagnosis, and treatment. So this is the first part of the diabetes. So generally, if you have a child coming in with these symptoms, you want to make sure that they get all the testing done. Do you have anything else to add to the testing and what to do?
Well, the simplest of the testing is actually just to dip the urine, get a urine sample, and it's just dipped, and you just see loads of sugar, glucose in the urine, and some other indices in the urine will be off, but sugar is the main one you just see, because we shouldn't be passing sugar in our urine.
So as a parent at home, if you notice that your child has all these symptoms, there's another thing we talked about before we started filming. In the past, we would ask patients that what happens when you pee outside.
Do you see ants crawling all over the urine?
Right, and guess what?
Ants like sugar.
They love sugar. So if you're playing outside and your child is peeing outside, and you notice that there was ants, and that was one of the questions we would ask as medical students here in Nigeria. You know, so yeah, if your child is playing outside and pees and there's a lot of ants around where he peed or she peed, then that could be a clue that your child has diabetes. So we're going to be talking about diagnosis and management in part 2. So please stay tuned.